Bismillahirrahmanirrahim. Welcome. This is the second lecture about ECG for Skill Lab for second year. My name is Adel Shabana. I'm assistant professor of cardiology and acting head of department. So, after we finish the physiology, let's talk about the practice. First, we always hear about electrodes and leads. So, what is the difference between electrodes and leads? Electrode is the conductive pad which is attached to the skin at certain places to enable recording of the electrical activities in the heart. So the stickers or the things which we put on the patient, these are called electrodes. And we have 10 electrodes. So we put 4 in the limbs, in the 4 limbs, and we put 6 on the chest. So we have 10 electrodes. But the lead is a graphical description of the electrical activity of the heart, and it is created by analyzing several electrodes. So the difference in polarity between 2 or more electrodes produces a lead. And traditionally, the side of the lead which has a positive electrode, it is the one by which we name the lead, as you will see in the next figure. The leads are like cameras which can detect the electrical activity of the heart from different directions. From the 10 electrodes, we have 12 leads. Okay, so electrodes are present in different spots on the patient's extremities and chest wall to view the electrical activity of the heart. We have 4 electrodes, as I said, which we call them frontal electrodes, and we have 6 transverse or horizontal electrodes for the chest. They are usually color coded, and there are letters on it in order to know where to put these electrodes. The positions are very important. So for the limbs, we have four electrodes. One you will find on the electrode, usually it is red, and it is called RA, right arm. So this electrode we put on the right arm of the patient, and usually we have to put some gel. If we have the old system of electrodes, we have to put a small amount of gel to allow better conductivity. The second electrode is LA or left arm, in which we put on the left arm of the patient. The third electrode, LL, left leg, we put on the left leg, and the last one is the right leg, RL, we put on the right leg. Usually they are red, yellow, green, black. Sometimes if the patient is in the ICU or in some places, they can put the electrodes on the extremities of the chest. So left arm, instead of putting it on the arm, we can put the sticker on the nearly below the left clavicle, the right arm below the right clavicle, the left leg and right leg, we can put them down in the end of the thoracic cage. They produce the same effect. What about the chest electrodes? The chest electrodes, they are 6. We call them from V1 or C1 to V6. It is very important to know the places of these electrodes, as we can see in this figure. And please, V1, it is the only one on the right side, and it is in the 4th space, not in the 2nd space, because many of the nurses and technicians who do the ECG are putting it on the 2nd space. Sorry, this is not the right place. We have to put V1 on the 4th space. Okay, so V1 in the 4th space, right side, in the right margin of the sternum. V2 opposite to it, but on the left side, so it is in the 4th left intercostal space along the sternum. V3, there is no specific position. They are always writing that V3 is between V2 and V4. Okay, V4, V5, V6 are all in the left 5th intercostal space. V4 is in mid-clavicular line, V5 in anterior axillary line, and V6 in the mid-axillary line. So we have 4th space to the right, 4th space to the left, 5th space mid-clavicular, 5th space anterior axillary, 5th space mid-axillary, and V3 is between V2 and V4. This is very important to know. In some machines, the electrodes are like this. This is the machines mostly in our hospitals. So these 4 are the 4 electrodes for the limbs. So they are like clips. You have to put some gel inside and put them around the patient's upper limbs and lower limbs. And for the chest, these are the chest electrodes, 6 chest electrodes. There is a bulb here, and there is a space here to suck on the skin. So you press on this bulb and put the electrodes, and when you remove it, the electrode will catch the skin by negative pressure. The problem from this machine is that they sometimes cause injury or small hematomas in the skin. If the patient is very sensitive, these areas after you remove the ECG, you will find in its place redness in its place. Okay, this is the new one. So you just put the stickers in the places you want, whether on the limbs or on the chest, and the electrode itself has clips. You can put it on these stickers. Okay, like here, snaps, whether it's a clip on or snap on, no problem. But just in the end, you put them. This is self-adhesive, and you can put them on the patient without causing much trouble. So in order to put the electrodes, first you have to ensure good contact between the electrode and the patient's skin, which means it's better to avoid very hairy areas. And some people say you can shave, some people say don't shave because you will cause injury, but you have to try to avoid the hairy areas. Number 2, you have to clean and dry the skin area. And sometimes some people say to shave the dense hair, and some people say it will cause irritation, so better avoid them. Eliminate any muscle tension, which means the patient should be comfortable lying flat, lying in the bed, very comfortable, not tensing his muscles. The clips itself, the clip on or snap on, no, it's not a big deal to know the difference between these two. And select the sites which are in flat areas or over soft tissue, because bones are not very good conductors for this electric activity. Avoid skin folds, and after the electrodes are in good position, you make the monitor on, check the cables, and be sure that everything is okay. You check in the machine that the waveforms which are coming for the ECG is always good. The word artifacts, usually artifacts means like noise. So artifact or noise means you will find some problem in the ECG tracing itself. We call this artifact or noise. And why this is happening? For many reasons. We have many types and many reasons. Sometimes intrinsic factor, extrinsic factor. For example, the cables of the ECG are not good, electrodes are loose, patient is moving too much. Some patients, like those with tremors or Parkinsonism or abnormal movement, may have they are not still, so the electrode will not be good. Sometimes if the patient is having his mobile near him or wearing any metal things, sometimes this cause also artifacts. Like here, for example, this tracing up here, you can see, you cannot see a clear baseline because there is too much fuzzy here. Okay, for this one you can see it's getting up and down. This one also, there is some area here it's not clear, maybe the patient is moving. This one also, maybe there is some movement. This one is baseline. I know that, yes, maybe there is cardiac arrest and the patient is already dead, but usually even with cardiac arrest you cannot find it a very clear baseline like this. So one of the possibilities that the electrodes are, or the ECG is dislodged. And this one also is considered artifact because the wave is very small, so you cannot read anything. So some people consider this also artifact. As I said, usually the flat line for asystole or for arrest, it will appear like this. It's not flat like done with a pen. Okay. In any case, in any way, when you find this ECG, you just check the patient. Is he alive or not? Okay. Thank you.